The first thing I tell my patients to do if they're afraid of needles is to ask the person who's administering either the shot, the vaccine, the substance, or drawing blood to ask them if they can use a smaller needle. That often helps a lot of people. Now, in some cases, the person cannot use a smaller needle, okay? But you can certainly ask. The next thing I always say, whether you're getting blood drawn or whether you're getting a vaccine or a shot, don't look. Don't look at yourself getting this done. I'll be honest with you. I get squeamish when I get my blood drawn and when I get vaccines. I do not look. I cannot look. Okay. So don't hesitate to do that. The other thing too is distraction. Distraction, honestly, is one of the most important things I believe with my patients who are afraid of needles. I always tell them, bring a book, have a movie going on your phone, put your earbuds in and be listening to your favorite music to distract you while you're getting your blood drawn or you're getting your shot or what have you. And the other thing too is sometimes even like a change in sensation, a change in pressure, like if you've got like something you can squeeze, something you can tangibly mess around with the other arm or hand that you're not getting the shot in or your blood drawn, that sort of tactileness can be very helpful if you're afraid of needles. Guys, I'm Dr. Jen Caudle. You can see we're jumping right in. We're talking about what to do if you're afraid of needles. Make sure you watch to the end because I have some special tips if you're for when you're getting blood work done that have helped for some of my patients. Okay, so all right, so let's keep going back. And again, many of these suggestions are going to apply for both if it's you're getting blood work drawn or if you're getting a shot or something like that. Next thing is make sure that you have told either your phlebotomist, the person drawing the blood, or the person giving you the injection, make sure you told them that you're afraid of needles or that you're having a tough time. The reason why is that they often can, number one, help make you feel more comfortable. Number two, oftentimes they've got some tricks up their sleeve because they've likely dealt with other people who are afraid of needles. So they can help you through this process and be supportive. I think that's really important. For some people who are afraid of the pain, sometimes we can actually use a numbing agent, either where you're going to get the injection. Not always, but sometimes that can be done. So you may want to ask if a numbing agent is possible to be used. Like if you're getting an injection, that may be the case as well. The other thing, and let me tell you, if you're getting blood work done, and like if you have a particular fear of like phlebotomy, like needles, what I would say is make sure that you've hydrated before getting your labs drawn and getting your blood drawn, because if you're more hydrated, your veins are going to be easier to find, okay? If you're dehydrated, it can make it much harder for the phlebotomist to find your veins and get the blood sample, and it may just sort of complicate an already like complicated situation, may make it take longer, it may be more, just tough, okay? So make sure that you're staying hydrated, all right? The other thing I should mention too is that if you need to get a vaccine, consider going to like a drive-through vaccine clinic where you can actually stay in your car. Someone can come to you, you can get your shot and just drive off. Sometimes that is helpful for people. They don't have to get out of their car. They're not in a medical facility, which might make them more nervous. So drive-through vaccine clinics can be very helpful in this situation. There's also a couple things I think are really helpful. Breathing exercises. I have a video on like 4-7-8 breathing. I will link that here. Just DM me if you don't see it. That can be really helpful for a number of things, whether it's a fear of going to the doctor, a fear of like getting your taxes done, like whatever the case may be. 4-7-8 breathing is a breathing technique that may very well help you not only before you come in contact with this needle in the medical setting or during. Okay, so breathing, exercising. Also, mindfulness and meditation can be really, really awesome. And then I've had some patients who, in therapy, if they have a really, really strong fear of needles and they just need to, I don't want to say just because it's really important, but they benefit from talking about it with their therapist and getting some other tips and tricks from their therapist on how to deal with it. So that can be very helpful. I would also say, if I didn't say this before, don't go by yourself. Go with a family member or friend, somebody who can talk you through it. And then the other thing I would say is the tip I wanted to give you that I've often used with some of my patients in the office. So my office has a phlebotomy station in the office, at the front of the office. So patients can actually get their labs done on the way out the door of the office after they leave the appointment. It's a separate lab person who does it. She does a great job, etc. But I have some patients that are really, really afraid of needles. And one thing that's helped them is two things. Either lying down when getting blood work done, especially if you're someone who may pass out. Lying down can be very, very helpful. And oftentimes in phlebotomy-based settings, they have the ability to do that. Not everyone does, not every place, but they can. The other thing that I've done with my patients, especially since the phlebotomy is in the front of the office, I've had phlebotomists in the past who've been so sweet and so kind and have literally brought back their equipment into one of the office rooms that I'm seeing the patient in. So the patient is already comfortable with the office setting, etc. They know the room and they're able to just lay right down there on the table in the office and get the blood drawn. And that's been something very helpful for my patients with that, because number one, they're familiar with the environment. Number two, also they're laying down. So if something happens, we can help them, things like that. So do not underestimate the importance of laying down when getting blood work drawn, if that may help you and if that's an option where you're at. There are many different ways to sort of approach this. I want you to write in the comments, are you afraid of needles, and what do you do and what have you done to get around that? Your tips may help other people. Please share this video with other people who may benefit from it. Please like and follow my page on Facebook, on YouTube. Please subscribe to my channel, click the little bell for updates. I'm on TikTok and WhatsApp and all sorts of things like that, social media at Dr. Jen Caudle, and go to my website, www.drjencaudle.com. You can sign up for my free weekly health newsletter. All right, guys, hope this is helpful.